Welcome, welcome, welcome to the UpKeep Pledge Pros Podcast, a podcast dedicated to unmatched value and unwavering support for our community and our customers. Today, we have UpKeep customer Ahmed Bin Badia, and he is the CEO of Tanmiyat Al-Ula, which is a consulting firm for all different types of industries, particularly hospitality, hospitals, things like that. Ahmed, welcome.
Welcome. Thank you, Brian. Thank you for having me. I'm very excited to be here in the UpKeep podcast.
Yeah.
It's a great opportunity.
Yeah, we're so glad to have you. It's always good to have customers come on, tell their story, talk about how Upkeep has helped them or their customers leverage all the things that maintenance has to offer for their business. So all that is great. I see you're in the workshop. That's always good to see that you're keeping that mind sharp and those hands busy. So before we get into everything, Ahmed, could you give me a little bit of a background? Where you started in maintenance, maybe, where all it came to fruition, and then ultimately what you're doing now.
Um, well, I started as an aircraft maintenance technician. I
Nice.
started as a freelancer in 2015. I spent almost 5 years. So I started in 2015 until 2021. I started the maintenance company for facilities. So it's because of COVID, the aviation sector came down. So that's why I thought, there's more opportunity in the healthcare and hospitality uh, businesses. And I could bring the aviation mentality of maintenance to that to those sectors. So yeah.
Sure. Yeah, I mean, I was in aviation as well in the military, um, and it's very strict. It's very
Yes.
by the book. It's
Yeah.
very organized and standardized. And I know when I was leading maintenance teams and building maintenance teams, a lot of that carried over, standardization of all things, right? Um, so tell me a little bit about what you're doing now as far as like your current customers where you're leveraging Upkeep. What kind of businesses are they? What are they doing on a day-to-day basis, and how are you interacting with them?
Um, so what we do is uh, we let the customer buy upkeep, and then we manage it for them. So, for example, the one of our customers is Al-Mishari Hospital. We have at least 30 subscriptions this year, and we want to increase it to 40. So they're very happy with it.
Nice.
It helps with the process. It helps with parts and inventory. Uh, so yeah, it provides also where most of the uh, how do I say it? Uh, so, for example, I don't know how to explain it, but let's say that the carpenter went to a room and fixed a table, and it wasn't a good fix. So if we get another request, we know that he made a low quality work, so that's why it broke
Sure.
again. So that's one of the problems that the hospital had. It's low quality of work, and that's what good about upkeep. We know that, okay, someone worked on in that location before, so we know that we have to investigate that.
Yeah, you're able to keep track of rework. That's what we call it, rework, right?
Yeah.
And you're able to label why that work was insufficient from a quality standpoint, right? And then you're
Yes.
able to make changes to either the process, the technician, the tools used, right? To ensure you get a quality repair each time. You can track that from start to finish, right?
Yeah. Yeah.
Yeah, that's awesome. That's good stuff. How about, when we talk about hospitality management, we talk about hospitals, we talk about facilities. At the end of the day, um, your customer is not necessarily an operation or a manufacturing facility, right? You're not trying to get stuff out the door to sell. You're
Mm.
trying to create, in the hospital's case, you're trying to create an environment that's conducive to safety, to regulation, to cleanliness, right? And ensuring that a patient's experience is very high. And that the people who work within the hospital, doctors, nurses, admin, all those people also are able to facilitate that experience for a customer by having sound HVAC systems, tables, chairs, a building envelope that's not pumping all your air conditioning outside, um, the mechanical, electrical, plumbing, all that stuff. So, have you found that Upkeep has helped raise the level of comfort or the level of the standard of living, if you will, in these facilities?
Yeah, it definitely helped, and also it gave them, uh, a sense that whenever they sent a request, that it's heard, and there is also the rating, so they can rate the work. Is it a bad quality or something? So, for example, let's say they sent a request that the air conditioning in their clinic is too cold, and the controller is not working. So if they put 1 star, we will know that uh, the technician didn't do a good job, and we will go and check on them. So they're very happy that they're heard. They're very happy that they know that what, if I sent it on Upkeep, uh, there is a follow up. There is a team that is working on it. Uh, uh, Also, it's I think that's about it.
So it builds a lot of trust.
Yes, yes.
Yeah. So I'm assuming in the past when, people in the clinic or in the hospital would make,
Phone call.
yeah, they'd make a phone call, they'd text, they'd say something, say, hey, this is broken, but they didn't really understand how it was going to be fixed, when it was going to be fixed.
Hmm.
Maybe there was some lack of trust in it being done correctly.
So they wouldn't even call. Yeah.
Yeah. So
Yeah.
now with Upkeep, they're able to skip all that. They pull their phone out or they go to a desktop, they submit the request. They don't
Hmm.
have to talk to anybody. They see that request that goes out. They know that there's people like you and your team on the other end of that. They're going to ensure that that is seen to completion and with the quality work. And then they get updates in real time as that work is being completed, right?
Yeah. Yeah. And also, what's good about Upkeep is that there is the QR code so it's the request portal, and also you have the app. So if they don't use the app, they can use the request portal.
Hmm.
And for every location, there is a sticker with the request portal and also the room number. So they can just scan the request portal and then add the location, and that's it. So it's the even it's very easy to use. It's not that hard. Just request portal, scan it, and you will get your maintenance done. All your requests are done. So it's we don't even want them to use any computer. Huh?
Right, right. Yeah, yeah,
So,
yeah.
yeah, it's
So,
it's a good solution.
so, when it comes to, I'm assuming, right, that you provide um, analytics and data to your customers, right, based on the
Yes.
work that's being done. So your customers' in-house teams are leveraging the system that you ultimately are managing, right? And you're able to take the data that is derived from those in-house teams, aggregate it into meaningful information that you can then use to change culture, change tasks, change priorities, change all these things at the core business, right? Um, what are some of those metrics that your customers are asking to see and understand?
So we have an audit system that we implemented in Upkeep. So it's basically an automation. So once a technician completes a work order, then the automation will add an audit checklist. So we have auditors, online auditors that will check. Okay, for example, did the is the maintenance satisfactory? Did he provide pictures of the maintenance? Did he provide pictures of the asset? So it's they want to see how many of the requests. So after so it's completed, and then you will get the audit checklist, and then we have an option also, or two options. That the first one is uh, failed audit and then passed audit. So this is one of the KPIs that they want. What's the percentage of um, failed audits, and what's the percentage of um, uh, past audit?
Yeah.
So yeah, it's I think it because before I provided them with a lot of KPIs, but they said it's a bit too much, so I just put this, and they're happy with it. So we have an increase in the uh, passing of audit percentage. So there is a steady increase.
Good.
Yeah, yeah,
That reminds me of when I was the head of maintenance in a food manufacturer. We would have the SQF, Safe Quality Food Audits, and we would have to follow GMPs, good manufacturing practices. So when I would write services or write corrective work, things like that, we would have the exact same thing where there would be a secondary check where you'd have to make sure, did I ensure all my tools were accounted for? Did I make sure there was no FOD, foreign object damage or debris, however you want to say it? And did I sanitize the machines, clean the machines after I had worked on them? And we would do a very, very similar process saying, hey, yeah, these things were done. We'd have QA go check. Okay, yeah, they did sanitize. They sign off on that check. Now we know where we're going as far as our safe quality food and our good manufacturing practices.
yeah.
Um, do they ever ask for any kind of manpower efficiency or capacity? Meaning you have 10 technicians at your facility, they're assigned, let's say, 8 hours worth of work a day. Um, do you measure their productivity, meaning the amount of work output in hours on work orders that they are consuming and the amount of hours that they're on site being paid? Do you ever take a look at, or do they ever ask for anything like that?
Yeah, they asked for it, and it helped with. So they will hate me for it, but I'll say. So the technicians used to do a 12-hour shift every day, but they have to work almost 8 to 9 hours. So they're doing 4 hours of overtime.
Sure.
When we started with upkeep, they used to have 12 hours, whether there is work or not. So after upkeep, it started to show that uh, they start working from 9 o'clock, for example, but their work starts from 7. And so we have 2 hours lost in here. And then after work, it's they count it as overtime, but they're not doing any work orders. So we can tell them, you know what, if you don't have any work order, you can't apply for overtime.
Yeah,
So that's the idea of it.
that's right. Yeah, I mean, of course. I mean, you're paying.
Yeah,
I've been a mechanic. I know, right? So I'm not being mean towards mechanics because I've been one. Um,
yeah,
but
yeah.
while you're
Because
there, you got to be turning, right?
yeah, if we're paying you, then we will close up.
Yeah,
We're losing money here. Yeah,
that's right. That's right. Um, when I've helped companies with their technician efficiency, things like that, their capacity, how much work realistically can a technician handle on a day-to-day basis, planning, all that. Um, you normally find that most organizations, technicians are like 30% productive.
yeah.
It's like,
That's on their phones or
yeah,
something.
yeah, it seems like, yeah, I mean, and no discredit to any organization that doesn't understand these things, but like, it may seem that they're doing all the right things. You may have high availability, not a lot of downtime, right? Maybe they respond very well to downtime and things like that. And when you actually get into the granularity of their day, they got a lot of free time. Um, and when I implemented many CMMS brands, upkeep included, I found that we weren't very productive, and there was a lot of there were a lot of things that we could do to become far more productive, right? And a lot of it comes in the ways of planning and scheduling, and how we generate corrective work, and how we perform defect elimination.
Yeah, yeah. Um, you know, it's sort of a change management type of thing. So it takes time till we reach like a 100% efficiency for technicians. Also,
You're never going to get there. It's okay.
yeah,
Shoot for 70. Shoot for 70. They'll love that.
yeah.
That's awesome. So what would you say when Upkeep was first rolled out? let's just use this hospital as an example. What was the biggest challenge that you encountered?
Um, well, it's providing training to technicians to use it. I think it's one of the hardest thing. Also, the change management because they're used to not doing any work orders to doing work orders. It's a lot of work. Also, maybe I know the system very well, so I would think that they know the system very well as well. So yeah, it's that type of mentality that I have to go and but the good thing about Upkeep is that the analytics shows me who's not working properly. Like for example, I'll check and see one of the technicians haven't logged in 2 or 3 days, so I'll go and check on him. Hey, this is how to use the system and all that. Also, whenever we have a new technician now, it's a lot easier. I could just, bring them to my office and then train them very well. And then, so yeah, it's at the beginning it was hard for them to accept, but by providing, uh, so what I did is I put the evaluation on Upkeep, and then so every month we would have like a prize. I think there is. I read it on Upkeep at what is it called? A champion
Hmm.
technician or something.
Yeah.
Yeah. So I took that from you guys. Thank you.
Yeah.
Um, so yeah, I took 3 or 4, and I taught them very well, and the rest uh, started learning from them.
Yeah.
So yeah.
I did the same thing. I would, when I would implement new systems and we were getting on our feet, I would make a reward system as well. I would do it two ways. Um, I would be democratic and say, hey, we're going to have a friendly competition. Um, I want to give whoever utilizes the system the most accurately and to the best of their abilities over this period of time, let's say 2 months or 3 months. What do you guys think we should win? Right. And most of them wanted a day off, a paid day off, or, something like that, which I was fine with. And it created a healthy uh, relationship, healthy competition amongst the team. What it also did is I also made it a group win as well. So if cumulatively they met a certain level of productivity or a level of utilization of the system, they would all win something. And what that does, Ahmed, is that now makes each individual technician a monitor of the other technician. So if you have one technician who's doing very well, who's utilizing the system, who's leveraging the way it should be, who's putting all their notes in, taking pictures, and they know another technician who isn't, that technician is going to say something to the other technician because their goals and benefits are now reliant on that other team member.
Okay, that's interesting. But what do they get uh, by
It,
the like, for example,
it
I'm
could be
learning.
it could be gift cards. It could be a sponsored lunch. Like, hey, if we all meet our goals as a team, we'll take an hour lunch out of the day. You tell me what you want. I'll go get it, bring it back to the facility. We'll all eat lunch together, talk about our next set of goals that we want to achieve. Maybe we want to bring our productivity up 2% or 5% over the next 3 months, right? And then we'll have a bigger, right? So you're bringing them together and giving them a stake in their own destiny, right?
Yeah, that's
All
perfect. Yeah.
while building strong rapport with each other and building strong utilization of the system that they are going to be reliant on and ultimately you are going to be reliant on.
Yeah, yeah, that's perfect. Yeah, I had a problem with that. That they will know that technician A is the best one, and he will get the rewards. So they wouldn't work. So that's
You got
one
to
of the
bring them
things.
together.
Yeah, yeah. That's why I'm trying to get a better idea. So thank you.
Yeah, you're very welcome. Or you leverage technician A's experience
Mm.
and have him help be your champion in explaining to the team why these things are so valuable and why he does it so well. Because maybe he knows we need more manpower, right? And you're not going to know to be able to make those arguments if you don't have good tracking of hours, right?
Yeah.
Maybe they need they need new tools, right? But you're not just they're not the hospital's not just going to spend 10 grand on new tools for everybody. You need the data to say that the technician made 10 trips to the tool crib and couldn't find an inch and an eighth wrench or a 55 millimeter wrench, right? Because it doesn't exist,
Sure.
right? So
Yeah.
you don't know those things. The technicians are the conduit of the reality of how your maintenance system is functioning. So we want to bring them in. We want to leverage their experience. We want to connect them to the big picture, make it valuable for them. Because at the end of the day, they may not think that, but it really is for them,
Yeah. Yeah.
right? It's for the business and it's for them. They're ultimately drivers of the business.
That's perfect. That's perfect.
That's why I brought
It's
you on here, Ahmed. I wanted to give you some brain nuggets. So what else, man? What's the future look like before we wrap up? What's it look like for you, your company, what you want to do more with Upkeep? What's it look like? What are the goals?
so our company provides uh, the so we provide to business to consumer and business to uh, business.
Hmm.
Uh, so what we're planning is as we get more business to business customers, we will implement upkeep for them. So we'll go. Yeah. So we finished. We're almost finished with the hospital. I think it's going very well. Um, since they want 10 more subscriptions, they're even adding. Uh, so we have something called an environmental checklist.
Sure.
So
Yeah.
so infection prevention works on it, housekeeping works on it. So it's multiple departments that has nothing to do with maintenance, but they uh, upkeep helps break it down because it's a huge list. It's
Sure.
so and it so for example, it would be this checklist provides almost 600 work orders per month, which is a lot.
It's a lot.
Yeah, yeah, but it's one checklist broken into 6 sectors for
Sure.
every department. So they used to do it. Uh, if we uh, divide it by 6, it will be 100 per day per month. So it's. I thought, you know what? Let's do it. Let's multiply it by 6 and remove every checklist by department.
Mm.
Um, so yeah, let's go back. So yeah, so business to business is provide upkeep to facilities, and also we have like a business to consumer. We could also use upkeep for our company, but we need to grow a little bit until we find that
Sure.
yeah, use that solution.
Yeah, that's awesome. I've used Upkeep as a service provider in the past. So
Mm.
companies that I worked with didn't have Upkeep, but I used it to manage their assets as
Yeah,
a service provider. So it can be used like that as well,
yeah,
which is great. And that's kind of in your alley. If you were to ever to grow to the point where you are now employing highly skilled craft people, technicians, things that are going in and maybe doing overhaul work at these facilities, or they're doing consultation and helping the teams build better machines or make better things or improve uptime, you could manage that work with Upkeep as well.
yeah. I think what's missing in upkeep is like a project module, maybe. So if it works, then it would be nice because a project module would be nice. It's like um, an SAP system, SAP.
Yep.
It's called a master work order. So it's like a master work order for like let's say renovation of wing A.
Yeah.
So everyone can, like for example, the painter can go and create a work order based on the master
Sure.
work order. Now it's on upkeep. It's a split work order, but it's not. Um, uh, it's hard to train the workers on it, I guess.
Sure. Yeah, they have to understand the split work order process.
Yeah,
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 but one thing that we try to keep in mind with CMMS, computerized maintenance management software or systems, their maintenance tools, right? Um, so at their core, they're for the maintenance function of a business, right? For them to leverage all of those types of things. When you get into the SAPs and those type, there are business management software. So they're going to incorporate a lot of different things that maybe individually aren't very good by themselves, right? So like SAP's maintenance software is like a PM scheduler or something like that, right?
And it's too complicated, to be honest. I've
I
worked
you
on
you said
it.
it. You said it, not me.
Uh,
So
and also, every work order would give you like 20 pages or something.
yeah, and there's
Oh,
like codes and things you have to know and yeah, so that's what I mean, right? So it's available, but it's maybe not the best tool for the expected outcomes. Whereas like Upkeep and other CMMSs, they're deriving the tool for a specific outcome, and that's the maintenance team, right?
yeah, it's for SAP. It's you print a work order for the technician, and he fills it up, and you have to enter it into the system. So Upkeep removes the a lot of the so it removes the paperwork and also removes the data entry. So
Yeah.
it
In
helps a lot. Yeah.
in a sense, it removes the variability, right?
Mm.
Because one technician is going to interpret and communicate issues differently than the next. And if that's digitized and it's standardized through a form that they can only say yes, no, multiple choice, and you're going to get the same types of information from every single technician, you've now removed a level of variability that at the end of the day, you ultimately have to deal with to get the appropriate data, right?
Yeah.
Awesome. Ahmed, it's been an absolute pleasure. I want to give you the last word. How can people get a hold of you? Is there, don't put your cell phone number on here. But how can they get a hold of you if they want to hire you, if they want to talk maintenance, they want to talk facilities, they want to talk upkeep, how can they get a hold of you?
Well, they can contact me through my LinkedIn. I think it's the best option. And we have an email. It's sales@tanmiyat-ula.com.sa. So it's both of those can work with me.
Awesome. I encourage people to reach out to Ahmed. It seems like he's got a good handle, and specifically, he has customers that are in hospitals. Hospitals are highly regulated, and if they're trusting Ahmed to manage the maintenance remotely and on site, he's got to be doing something right. So, Ahmed, on behalf of Upkeep and myself, we thank you so much for being a customer one and for coming on the Pledge Pros podcast to talk to me a little bit today.
Thank you, Brian.
You're very welcome, and we will see you on the next one. Thank you.